Hi, my name is Breanna Molina, and I'm going to be inserting a urinary catheter today. So the first thing I'm going to want to do is I'm going to assess my patient for why they're getting the catheter, which type of catheter they're going to get, and also the last time they voided. I'm also going to make sure I know and to check their allergies for betadine or latex, because the tips of the tubes are made out of latex and we use betadine to clean the perineum. So then I'm going to gather all the supplies necessary, and then I would introduce myself to the patient, asking them to identify themselves to me and checking it with their armband. I would then explain the procedure and answer any questions that they have, and then I would raise the head of the bed. Or not the head, but the whole bed. Okay. Once the bed's at a working height, I'm going to make sure I provide privacy and I wash my hands. I'm then going to pull the covers back, making sure I try to keep it as discreet as I can. Also, I'm going to have them lay in supine and make sure I'm going to raise their legs up, bending at the knees. Next thing I'm going to do is provide a bath blanket to provide further comfort and just a little bit more privacy. Okay. Then I'm going to wash my hands, and I'm going to put on a clean pair of gloves. I am then going to clean the perineum, making sure that since this is a female, I'm wiping from front to back. Once this is done, I will discard my gloves, wash my hands again, and then I'm going to make sure that I have the correct catheter kit, making sure that the French is the right size, and also that the gloves inside will fit my hands for this procedure. We'll then open it. I will then open the package in our sterile procedure, pulling that first tab and then the two in the middle, and then the last one towards myself. I will then set my sterile gloves to the side, and then two drapes are provided. The first drape, I'm going to want to make sure I tuck it under the buttocks, noting that I can touch the 1-inch border as it is already considered contaminated. And then also this other drape, which will kind of section off the area that I'm working in. The next thing I'm going to want to do is I'm going to put my sterile gloves on. I'll just wash my hands one more time just in case I touch the patient. Got them dirty. So I'm going to open my sterile gloves, as we've already learned, unfolding the flaps and trying to make it as straight as I can, kind of pulling it out flat. I will then put my dominant hand's glove in first, and then my non-dominant hand. And then once I have my gloves on, I'm going to reach into my sterile field and grab my tray, and I'm going to set my water that's going to fill the bulb in there. I'm going to set the tray here, and before I get started over there, I'm going to make sure I have my lubricant, and I'm just going to go ahead and test the bulb to make sure that before I get started that we have a working functional bulb. So I'm just going to test it real quick. Seems to be working fine. So then I'm going to go ahead and lubricate my tip. Just go ahead and set this inside here. Next thing I'm going to want to do is I'm going to make sure I open up my cotton tip applicators and set them inside and discard this. So then I'm going to, with my non-dominant hand, make sure I spread the labia, and I'm going to clean the labia furthest away from me, making sure I go in a downward motion. I will then clean the one closest to me. And lastly, I will clean directly down the middle through the meatus, or over the meatus. Since this non-dominant hand is now not considered sterile anymore, I'm going to grab my catheter and just place it in this sterile field. Then I'm going to insert the tip of the catheter into the meatus. Only going about 2 or 3 inches since it's a female. I will then wait and make sure I see urine return to the tubing, and then I will go 2 more inches. Next, I will then inflate the balloon. And if the patient were to complain of any kind of pain, I would know that I'm not quite in the bladder and I'd need to stop, unfill the balloon, and try to insert it further. Now that this is done, I would pull it and make sure that it's sealing the bladder, and I would also don my gloves, wash my hands, and then I would put on a new pair of gloves to secure the tubing to the side of the leg. And then I could always hang this off the side of the bed. And then once that is done, I would clean up my sterile field and document.